You're listening to Retail Soundbites.
Hello, everyone, and welcome to the Kantar Retail Soundbites podcast for the week of August 25th. I'm Barry Thomas, our Senior Global Leader, serving clients on global commerce, marketing, and future tense topics. Thank you so much for tuning in, and joining us on every show is my pod partner, Rachel Dalton.
Hi, everyone. I'm Rachel Dalton, Head of Retail Insights for the Americas here at Kantar. Our podcast is intended to share knowledge and insights on both North America and international retail and restaurant verticals. We kick off each podcast with a news and notes section to share innovative and impactful stories from the past 2 weeks. And then we introduce our Kantar experts or guest speakers to share insights on critical topics in commerce today. And today we are really excited to welcome to the podcast Jared Childs and Julie Fleisher from the company Soda Health. And that's expected to be a great conversation. But first, back over to you, Barry, to officially kick us off with news and notes.
Glad to do it, Rachel. Let's see. For the weekend, Leslie and 3 of her girlfriends went up to New York City. They were doing the U.S. Open up there. All right, 4 nights, Rachel. I think you would have enjoyed going with them. That's pretty good time. A lot of restaurants, and they were pretty much digging it. And with me and my sons, I'm just going to say this real quickly. It's football time. Like it's pivot. Like we're ready for fall. So for the weekend, I was with some friends my age, and we all got together for our fantasy NFL football league. My first time into fantasy football. Pretty interesting. A lot of fun. It's kind of like being in a fraternity. It's just it's good. It's good for men, I think, and old men like me. And then this weekend, we're getting ready for college football. We'll have the sons over, maybe the girlfriends, and we're just going to be watching college football, kind of partying, a light party kind of atmosphere over here. Maybe a jump in the pool. I don't know. But it's college football. We're hyped. NFL football hyped. Let's go.
Oh, amazing. Well, really exciting. For the U.S. Open, gosh, I've gone so many years to the U.S. Open. We couldn't squeeze it out this year. But gosh, it's such an electric feeling being there at the U.S. Open. So that must have been an amazing trip for Leslie for sure. We are winding down summer, and we head back to school this week on the 26th. So it's been a really busy week for me, and the kids are just kind of gearing up. I have a high schooler now, a middle schooler, and an elementary schooler. So 3 schools, 3 emails, lots of logistics and forms, and it's been one of those weeks, but fun. Always fun to start kind of a new year and a new outlook, and it's getting a little cooler, so fall is kind of around the corner.
Love it, Rachel. Now, mom is integral to back to school, in my opinion. I just think if you have 2 parents and you're fortunate to have 2 parents, it's all about mom. How would you grade yourself so far? Like getting them ready? Probably an A+?
I don't know if I have an A+. I mean, maybe an A-, B+. I don't know. It's been a whirlwind just trying to manage it all and keep all the balls in the air. But in sports, on top of that, starting of soccer season and meetings and keeping it all in the air. And it's all good stuff. All good stuff.
I love it. Well, they're lucky to have you. No doubt. All right, Rich, I'm going to kick it off with one of my sort of favorite restaurant chains. It's coming out of Smoothie King, and they're launching their first ever, first ever. It's kind of strange, food menu. And of course, this is all tied to modern health, certainly GLP-1 drugs. And it's a first for the brand, and it's called their Power Eats menu. And I just think it's really interesting. I was talking to 2 food and beverage large clients this week, and we're all kind of inspired by what they're doing over there. Listen to it sounds delicious, Rachel. Their health forward menu includes 3 loaded toasts, one starting with peanut butter toast. Then they threw some bananas on there, strawberries, blueberries, a drizzle of honey. Second one is a chocolate hazelnut toast. Okay, that has obviously chocolate hazelnut spread, strawberries, blueberries, and then they put some granola on there. And then their avocado toast with fresh avocado and finished with this incredible seasoning, apparently. And this is all towards just providing consumers what they want: more flexible, portable, convenient, and really important, nutritious choices throughout the day. So that sounds pretty good. Do you like it, Rachel?
Sounds pretty good to me. I always find I'm looking for the same. Like Dunkin' has avocado toast. I'm like, score. Like I'll get that if I'm out and want something relatively healthy. But yeah, there's not. It would be great to have more options just in general. So that's a great initiative. And are you going to try it yet, Barry?
Well, I haven't, but I will definitely update you because there's a Smoothie King near us, and I will definitely get that peanut butter toast. I'm all in.
Awesome. Well, my first piece of news is out of Retail Dive, and it's about Amazon and Macy's partnership. We're seeing a ton of partnerships in general happening in retail and in commerce. And this is yet another where Macy's Media Network is piloting its first test with Amazon Retail Ad Service, which is basically the aggregator service Amazon launched earlier this year. And basically, what it will allow for, it will allow for Macy's partners to purchase ads from Macy's network, but through the Amazon ad service. And then advertisers can actually manage their sponsored products or whatever other media investments they have for Macy's, but they can tap into the expertise that Amazon's network offers, specifically around targeting and measurement, which are two key things of media planning. It will launch in the fourth quarter, like early in the fourth quarter in advance of holiday. And it should be really interesting. It's going to be on Macy's own dedicated system. So they do have control over the full ad experience. And it also enables placements on Macy's Media Network on platforms like PackView. So just a really interesting partnership, and definitely will follow kind of what happens with that.
What do you think, Rachel? I mean, it's kind of we're going to continue to see more of this, right? Frenemies, like you may not want to be best friends with Amazon, but we have to partner with them given the audience and just the power, right?
Yeah, I mean, just the power, the sheer reach that they provide, and just access to U.S. shoppers around the country is just, you can't compare it. So, yeah, we had Commerce Now earlier today, Barry, our free webinar series that we do. So anyone who's listening can always jump on and access those on our website. We talked about other partnerships, around fulfillment and Amazon's Buy with Prime and Walmart's Go Local. There's so many services that some of these expert retailers are able to now offer out to others. And it really creates this kind of win-win-win opportunity for both. So I think that's what's going to happen here too.
I hope so. Maybe soon we'll see some results and maybe update the audience. But I think that's a really cool story for sure. All right, so I just think this is a bigger trend for commerce and brands, and this story just kind of highlights it. It's coming out of Ad Week, and it's basically publishers we all know are facing headwinds, big ones, with the oncoming AI search and AI answer engines, really. And so because of that, it's another tailwind for creators, and they're gaining speed. So the disruption in SEO and the rise of performance-driven influencers is steering marketing dollars, towards creators. Just another win for them. And the rise of these AI-powered answer engines, we know, is threatening publishers, but also many consumer brands in terms of just becoming, AI visible. And it's kind of a new day for marketing. And I think what's interesting here, and this story talks about it, is that creators, kind of a really key point, everyone, they're just less dependent on search, period. You got to remember, their audiences arrive by choice, not by search. Kind of a big deal, putting them closer in many ways to purchase decisions. So this is making, creators even more valuable to brands, especially with the more performance-driven tracking that's happening, and the fact that they're just not as dependent on search. So I think it's kind of a big deal, Rachel.
Yeah, it is. It is a really big deal. And we know influencers are really driving so much of that discovery we're seeing on social media. And we know up and coming, shoppers like the Gen Z generation is it's always on social. So and influencers are so tied into that, sort of creating these authentic communities. So yeah, really massive opportunities there to connect with influencers for sure. So out of Modern Retail, Barry, this is an article about Target. It's been in other places as well. I think Supply Chain Dive. This has definitely been covered, but really interesting because Target is relooking at how they use stores to fulfill their online orders, so that they can just drive overall more efficiency with their fulfillment process without affecting the in-store experience, which has been happening in a number of its stores. They almost have too much to do in some stores that aren't really set up properly with this proper space to fulfill online orders. So they've started this sort of test and learn in the Chicago market and a variety of stores there, and basically having some of those stores completely stop fulfilling online orders and instead shifting fulfillment that would normally come through those stores to other larger Target locations. Um, if you remember, like at the start of this year, Target has said that like around 96% of its net sales volume was fulfilled by stores versus warehouses. But now they're looking to shift the balance of the number of stores that are doing this. And hopefully it will help drive up store experiences and allow associates in stores that aren't as equipped to handle online fulfillment to better help customers in store, to make sure, shelves stay in stock, to help with drive up and pick up and all of those sorts of like store experiences, and make that better for the Target guest.
Timely store. We all know Target has many headwinds. I used to listen to those earnings calls and still do with Brian Cornell, in the past. And they were so proud of the fact they were using stores for fulfillment. And then I wonder if you saw this. When I would be in Target stores, gosh, I would just see so many side counters empty and or these red, mobile gondolas being used for pick, kind of just blocking up the aisle. Gosh, it
Yes.
just felt like, a little bit. I mean, I'm not crazy here, but it felt a little bit like a warehouse in the Target. And I know
Yes.
Walmart, right? Walmart struggled with it, but like most things, Walmart's way ahead and has figured it out in large part. But Target, I don't know. They have to figure this out. So it's a great story. What do you think? That's what I saw.
Yeah, I mean, I'm a fairly frequent Target shopper, but I've definitely seen changes. I mean, back to school is totally wiped out. And granted, partly my fault because I went really late to get my back to school, but I mean, completely wiped out in my local Target, right, right at the start of school. And yeah, a lot of times it's hard to find people to help you check out items. So yeah, I think this is a great move. I think there are some stores that probably would do better to not be fulfilling and have more of the focus on the actual store, making the experience nice for customer shopping, which has always been the hallmark of Target. So excited to see that kind of shift and change hopefully soon.
Good point. Well, we'll wait and see. Wait and see. Let's see. My last story, Rachel, another shameless plug. I wrote this blog. I thought it was kind of, just in my own little tiny world. I thought it was kind of worth just talking about because it's sort of a forgotten asset or story with respect to retail media. And I guess my point is the most powerful, without question, the most powerful retail media screen, it's already in the stores. It's the most powerful and valuable, and it's not necessarily a new digital screen on the end cap at Walmart or the video sort of situation that was rolling around in Walgreens and kind of that did not go well, obviously, or a new kiosk at Hy-Vee, let's say. It's what shoppers are already holding in their hands, and they're looking at it several times during their shopping trip, as our data shows and other data as well. It's just the mobile phone. Think about that. So, this is why I just think the mobile phone is already such a powerful screen for in-store / retail media. It's ubiquitous. Nearly every shopper has it. It's personalized, clearly. It can be. It's very shoppable, of course, and it's just always on. And I just think we're seeing more examples of retailers and brands taking recognition of this. And so certainly Walmart Connect now is tying shoppable mobile ads directly in in-store browsing, geolocating that. Kroger doing the same thing, and they're doing a very good job tying it, to their loyalty program. Have to give Target Circle credit. There's several examples of them partnering with brands with potent metrics on driving sort of the digital moment of decision within the store, where that's basically your phone is the most helpful associate in the store, and it's moving you to purchase. Really interesting. Target has some great best practices here. And then Sam's Club, just came out, with their scan and go mobile checkout. And of course, you can have relevant, actionable ads there to kind of help the moment of truth. So there's just a burgeoning of examples here. And I often just think we forget, that screen in the hand of the shopper, that mobile phone, that may be the most powerful in-store media network now.
Yeah, I think you're totally right, Barry, because there are quite impressive screens in stores now. So much nicer today, really impactful across. There's so many examples we could share too across channels of what that looks like. But retail media needs to be more about just screens in stores to really have that omni-channel success. And the phone is really the conduit to that, as well as omni-channel technologies around labels and QR codes and all of the other connection points, geolocating, like you mentioned. But yeah, we're doing a study, as you know, Barry. We're talking about retail media at a crossroads and sort of what is that next big step. Are retailers really going to invest heavily in store, and what that looks like? Because that's really their point of difference versus Amazon. It's just so much further ahead than other retailers in retail media.
Exactly.
So my last piece of news is from Fortune magazine, and it's about another kind of acquisition. This is kind of the time and space for M&As in retail. And this news is about Keurig Dr. Pepper buying the owner of Peet's Coffee with an $18 billion deal. And then basically the plans to break up the company so that they have a separate coffee company versus a cold beverage company. And remember, it was back in 2018 when Keurig Dr. Pepper merged. So now they're kind of pulling this apart again. And the article mentioned a couple of things. Obviously, headwinds from tariffs on coffee coming from Brazil is a challenge. There's a lot of interesting things here to think about. But what the article talked about is that these two focused companies will be better on their own than the combined company as it stands now. So really interesting. They said the coffee side will be about 16 billion. The beverages side will be about 11 billion. That they'll save $400 million in the next 3 years because of the merger. So yes, these two companies will now be separated in the near term.
It's big news in the beverage industry, Rachel. I will say 2 points. One, coffee is hard. I mean, I knew a little bit about this, working at Coca-Cola. And when Coca-Cola purchased Costa, the ambitions, the dreams, the vision, the meetings. I can just remember it. Everybody was just so optimistic. And then reality hits. And what's happening? Well, years later, maybe, I guess it's been, I don't know, it's not quite 10 years, but since Coca-Cola purchased Costa, they're now selling Costa. Probably, hold on, maybe for $2 billion less than they purchased it.
Right.
Ouch.
Yeah.
And, Coca-Cola knows a lot about beverages. It's just coffee is just a bit difficult. Second point is, I think the way perhaps you can make it work is what, KDP is doing. They're separating it. So I'm going to have cold, let's just call it, beverages, and then coffee.
Yes.
And I do think that may work, right, Rachel? But I promise you, just getting out and just like making coffee work, and we're all going to be happy. It's not so easy.
Yeah, it's a very unique kind of beast on its own. So yeah. All right. Well, Barry, I'm very excited to welcome our guests for today's podcast. We have with us Jared Childs and Julie Fleisher from Soda Health, a really unique and interesting company, and can't wait for this discussion. Jared is an entrepreneur at heart. He is a consumer junkie. He started a retail business back in college that evolved into a pop-up as a service, where he worked with a handful of D2C brands like Bonobos, for example. He shut down that company in 2018. He then joined Shipt, where he was tasked with growing membership through B2B partnerships. He worked with Sprint and Disney and many other brands on bundled memberships before discovering the supplemental benefit space. And Julie spent many years at Kraft Foods, building brands, creating high payback campaigns, mining data to identify the right moments, and messaging to drive outcomes. After leading global customer intelligence at Weight Watchers, Julie joined Soda Health to build an exceptional member experience, making accessing healthcare just feel much simpler, warmer, and easier. Julie brings consumer strategies and 360 engagement to Soda Health. So welcome to the podcast, Jared and Julie. Really, I'm happy to have you on.
Great to be here.
Thank you. We're happy to be here.
So wanted to just get a better understanding first for our audience that may not know about your company, Soda Health. Can you tell us a little bit more about it and just how it got its name?
Yeah, sure. So we are not selling Olipop competitors over here. Soda Health, Soda actually stands for social determinants of health in our world. So it's a phonetic play on that. And we really exist to give folks the resources they need to live healthier lives. And so we are a benefits platform that works with large health insurers. You can think your Blue Cross Blue Shields of the world, to put resources onto a piece of plastic, a debit card that we power the fintech of. And those benefits can range from OTC products to healthy food products for diabetics, all the way to things like rent and utility assistance or transportation for folks to get to and from the doctor, physical therapy. You can really think of us as any benefits that a health plan wants to provide outside of the four walls of traditional healthcare. When you think about preventive benefits, that's where we show up, load dollars on card to make it easy for folks to spend those things.
That's awesome. And tell us a little bit more about that. Why should our listeners be interested in this discussion in general? And tell us a little bit more about Medicare Advantage.
There's this magic space in which we exist that's one part retail, one part healthcare, and then really one part, fintech play. And so if you think about where we operate, when you look at Medicare Advantage, for example, which is one sector that we serve, there's about 35 million members on Medicare Advantage. They're people 65 plus that have dollars that are put on these prepaid debit cards to be used for the kinds of products and services that help them with preventive healthcare. So you can think about OTC, you can think about food, utilities, other things like that. So where we come in is we are fulfilling this benefits administration for them. But really what we have is 35 million people who we know. They're known, they're addressable. We have, all sorts of information about where they live, how much money they have on a card, when that money is going to expire or reload, and what kinds of products that they can use these dollars on. So as you think about from a CPG's perspective, how do I find people very efficiently that are interested in my category, that have dollars to spend there? And in particular, I think it's really interesting that these are dollars that need to be spent or they disappear. So there is a time element to it as well. We have the ability to connect CPGs to these members in retail to spend their dollars on these products that help them live healthier lives. So it's really a win-win-win. It helps people who, maybe on fixed incomes or are using these dollars expand their effective value of their benefits, stretch their dollars further. It helps CPGs efficiently target people who are in the market for their products. It helps retailers because it's dollars that are running through their store. And it helps health plans because when people are buying the kinds of preventative health products that keep them out of the doctor's office, out of the hospital, the health plan wins as well. So it's this really beautiful, confluence of factors. And what gets exciting as a person who wants to support, human beings who have needs and who have limited resources, but also support the brands that serve them, this connection that we can make is really pretty special.
It seems like, yeah, as you said, Julie, it's a massive opportunity to tap into dollars that are already existing that may not be spent. And why wouldn't a brand want to think about linking back to that opportunity? It's just sitting right there for them. I don't know that many know that this is something that exists, at least on the brand side. So it seems pretty exciting.
Yeah.
The space has really exploded in the past 7 years now. So 2018 was the first time that these cards in the Medicare Advantage space really entered the market. And at the time, you're talking $150 a year that somebody may have. The average benefit value now is $1,500 for the average Medicare Advantage user. And out of all those dollars on cards, about 30 billion is addressable by most brands, right? So you're talking dollars to be spent on OTC and food products. And Julie and I have been surprised as we're talking to brands and really building out this use case to give folks really high value offers and discounts, how many don't know about the space. And so when we dig in and talk about all the things Julie just mentioned, we have this truly like magic customer, right? And in our case, $500 million are loaded onto cards. We know exactly when they can spend it, right? When it expires, what they buy, and when they're in store. And so all of that mix of factors is unique to brands that are trying to reach that health conscious consumer in those categories.
And I think about it, I mean, from a Kantar perspective, I think your audience will appreciate this. When we think about traditional media, it kind of stops at age 54 plus. Nobody pays attention to folks in this target age range, but there's a lot of dollars that they have that are discretionary dollars to be spent again, or they disappear, trillions of dollars. So we have the opportunity to help brands reach these consumers that, typically are invisible to a lot of these brands and from a media perspective.
Yeah, that's a really good point. I mean, one of our colleagues here at Kantar, Jay Walker Smith, has done a lot of work just in terms of population and various cohorts, and has recently published some charts that talk about age 65 plus actually being the fastest growing cohort in terms of just total numbers, but also in terms of spending.
Yeah.
The percent of spending for consumers, 55 and older, is up like 50% versus the index base year that he evaluated against many years. So there's many people, and there's a lot of money also in this population. So, it's, I think, a cohort that more brands should be spending a little bit more time on than they are today. A lot of the talk is Gen Z, but there's so much opportunity with this older generation, and particularly in the healthcare space where, they really rely on information and support and, helping them kind of along the health and wellness journey.
Yes.
If I'm an investor listening in, which probably aren't that many investors, but boy, I really like what I'm hearing. One, you're really right in the middle of something we call modern health. And there's a lot to that, but you're certainly a part of that. Let's just call it wellness. Number two, one of the big factors with modern health is affordability. It's expensive health in America. And yet you're kind of on the affordability end of that with kind of what you're doing. Then thirdly, Walker, especially, we talk about sort of the silver era. And, well over half the wealth in this country isn't with Gen Z or millennials. It's with people like me, older, heading, in their 60s. So who is the core consumer, if you would, just like give us a little more, like who's the core consumer? And then do you have like a best practice of a CPG that's working with you and they're reaching this new audience and it's profound, it's driving transactions, it's driving brand equity? Like, tell us a little bit about that.
Yeah. So, we've done, not surprisingly, we've done, a whole host of consumer research. So we've created a segmentation and we understand the different consumer segments that are served. One of the amazing things is really because it is Medicare, it's kind of everyone over age 65. So the total addressable audience is very, very large, but there's different segments with different needs that vary based on their, health conditions, that based on, their income status, whether they are, primarily living off of Social Security or whether that is augmented by, pension and 401ks and retirement funding and things like that. And then different lifestyle needs that they have. And so they will make different choices in terms of their healthcare plans based on those different variables and factors, which will then identify different pools of money to serve them from a CPG perspective, from a consumer goods perspective. And you think about, modern healthcare, there are so many of the products that all of the brands that, listen to you and that, we're used to serve, that really work very hard in keeping people healthy, keeping them out of the doctor's office, keeping them out of the hospital. We also, because we are not just a financial platform to help people buy things, we also have an engagement platform on top of that. You think about any time somebody is using this card in store, it's an opportunity for us to connect with them. So we can tell them what they've spent and help them working with CPGs provide, extra dollars and discounts to make their dollars go further. But we can also take that opportunity to do things like remind them, hey, don't forget to get a flu shot, because that's another way to keep you healthy. And by the way, your health plan probably offers a reward when you get a flu shot. So maybe that'll, give you another $25 on the card. And by the way, you're shopping at Safeway right now, which has a pharmacy 20 yards away. And we can actually send you to that pharmacy to get your flu shot, to get that $25 reward that's loaded immediately on your card that you can then spend again when you're shopping. So we think about modern healthcare, as you talk about it, not just in terms of the kinds of products that we're connecting people with, but also the kinds of resources and services, all in the name of keeping them healthier and really improving the quality of their life.
Yeah, Julie was mentioning the engagement platform that really she has led the charge on at Soda Health. And that was one of the key insights that led our founders to launching Soda is when you looked at the landscape of the folks we compete with, they're largely putting dollars on cards and restricting it, right? So they're just kind of that transactional piece. But what they observed, and three of our four co-founders came from Walmart. I was at Shipt, as you mentioned, and built in this space. What you observe is you put dollars on somebody's card and they spend it, right? It's engaged users in that instance, but the health plans weren't getting any of the benefit of somebody actually participating in their health, right? And caring about their health plan every month when those dollars are loaded. And so we launched Soda to really bridge that gap between the transaction and the payment experience, and then that engagement with health. And what Julie just mentioned is really important when you think about the retailers that obviously support the brands that we're reaching here, is they not only want to capture that spend that's loaded onto the cards, but if they get somebody to the pharmacy for something like immunization, hopefully those folks eventually fill their scripts there. We know that a pharmacy customer at a retailer spends over $1,000 more than the average user in that store. So you think about this customer that we're really hitting them from every angle, the front of the store, the pharmacy itself. It just creates more value even outside of the dollars on those cards, this kind of halo effect of spend that brands have an opportunity to tap into. And Barry, you had mentioned brands that we work with today. So we're still in our early days of standing up our CPG business, but we've had some fantastic early adopter partners. And I would love to specifically call out Haleon and the team over there. They seem to have a really early read on this space and are making some intentional investments in how to reach this customer segment. And we did a recent offer with Voltaren products because we see pain as a really competitive category for our folks. And we're still waiting on some of the early results to come in. But one of the things that we saw was 76% of the folks who purchased Voltaren with our cards were first-time buyers of that, again, on our cards. So this ability to drive trial and then see that repeat purchase, I think, is a really powerful anecdote.
I would say the way we're thinking about it is just as Jared said, we're working really, really closely with these brands like a Haleon, like Voltaren. Also, Abbott is a really, really good first partner of ours. And we're really working together with these companies to design the programs that serve them and their consumers. So we're starting with things like high value coupons that we can mail directly to Medicare Advantage members that can be directly in their mailbox at the end or at the beginning of a benefit cycle. So don't let those dollars go wasted. Here's a high value coupon to go along with it. But we're also doing things like working closely with brands as we put together the Medicare Advantage catalogs. So if you think about the product catalog, it's not a catalog like you're really used to it. Medicare Advantage members will keep this guide to how they can get the most out of their supplemental benefits in home and refer to it every week before they go shopping. What are the brands that are covered? What can I buy? So it's a really wonderful opportunity for us to highlight some of these brands and really give them expanded mind share with Medicare Advantage. So somebody, when they're going to the store, they have their card, they think Voltaren because they know Voltaren is something that's covered and is valuable to them with their Medicare Advantage dollars. And then we're also able to put dollars directly on cards. So we're working on a platform that looks like, card linked offers or click to activate. So we can actually put coupon values directly on cards when people are shopping with it. It's completely seamless. There's no need for any other kind of coupon. And the way we're structuring this with Haleon, with Abbott, with other of our partners is really think of it as an omnichannel kind of experience. We want to surround this member with these brands to help them understand the relationship between their preventative health, their Medicare Advantage dollars, and these brands that serve them.
Great example. For the record, I'm a huge Voltaren user for tennis and much more. We have a lot of friends over at Haleon. So just one last question. I'll turn it over to you, Rachel. If I was talking to whoever about Soda Health, what are like 3 or 4 metrics I could mention talking to someone saying, if you partner with them, they can help you drive these 3 metrics? And what I heard, you shared, Jared, which is way at the top for everybody we're working with, is new to brand. Like, hold on a minute. That's a very important metric, new to brand. But what are a couple of other metrics you're seeing that you're able to help with your work?
I think of share of available dollars. So if you think about $14 billion loaded on cards for OTC products, when it gets to food, the numbers are even bigger, particularly as we go beyond Medicare Advantage. I want brands to not just get their fair share of available dollars, but get more than their fair share of available dollars, because these are dollars that, again, they are up for grabs and they disappear if they're not spent. So CPGs should be, brands should be spending a lot of time thinking about how much money they are driving through these cards, through these channels, and are they getting their fair share? Are they getting their greater than their fair share?
And Julie, would you say, especially in the context of store brands or private label?
I would, because again, if you've got people who are living on a fixed income who might be balancing their spending, it's very easy to go to private label versus a name brand. And so it's an opportunity with these name brands. And then one other thing I'll throw in before Jared jumps back in. There's a lot of sort of entry points and change points within this target demographic as well. So again, with Haleon, because we'll give kudos to them, they're thinking a lot about new denture wearers. When somebody is fitted for dentures, it is a huge opportunity, if you can understand who that member is early enough, who that consumer is early enough, to get to them with denture cream, denture cleaners, all of those different products. And you've got this window to build brand loyalty by serving them when they're just getting fitted. We have intelligence around that moment and can connect that consumer at that point of entry with these brands. So that's another opportunity that we serve.
That's a very hyper personalized opportunity, which is really where the name of the game is today. And you also have the closed loop analytics because you're seeing those purchases as well. So there's a lot of analysis that brands can do on the back end to show that it is proving out for them, it sounds like.
Yes, that's exactly right.
Julie and Jared, I was curious too on food, because food is part of what they can use their card for. Food as medicine, and the whole concept of food as medicine, which is also really important in terms of modern health. Can you talk a little bit about that? Are you mostly focused on building out more of the OTC side, or how does the food part play into that? I'm curious.
Yeah, so OTC is definitely the larger part of the addressable spend in the Medicare Advantage space as a whole. So that has been our focus primarily. But food is really interesting. We're starting to see a lot more of, you mentioned food as medicine specific programs that we're running. So folks with higher A1Cs, right, or who may be living with diabetes, a plan will invest in giving them dollars to spend on just healthy food, connect them with a dietitian through the Soda Health platform, and then they earn rewards every time they meet with a dietitian. So in those really like tailored, targeted audiences with, significant spend on their card in the food space, we're thinking through who are the brands that, fulfill that promise to those folks, that they can still eat enjoyable food and products, but it's better for them, right? And it's going to help them feel better. And so we're still in some of the early phases of working with those food brands, but an interesting one who we've been talking to a little bit is Olipop. And I don't know if you've had Olipop on the podcast, but they have done studies and are doing studies with folks with diabetes to show how they can reduce A1C when you switch from, say, a Coke, right, to Olipop because of that. So food is kind of the next frontier, I think, of where this space is going. When you think outside of Medicare Advantage, like SNAP and EBT, right, where you're seeing a lot of movement in the SNAP space around pulling out some of those items like soda and candy and focused on healthy food. I think the opportunity there is massive for brands. So a lot around the personalization of health as it relates to nutrition that is kind of at the frontier, I believe.
Yeah, that's amazing. And I'd love to also hear a little bit more about how you're making it, or how you're communicating to your consumer that this is an easy program. Like, they know they have dollars in a card to spend, but how are you getting the message across that there's a lot of opportunity they may not realize that's there, and how are you doing that from a communications angle?
That's where our member experience team comes in. And it's really exciting because I think about healthcare as like healthcare is the most personal of all of the different um, categories in which, people engage. And yet it tends to be really behind on really serving people personally and well. So being able to pull forward some of the engagement capabilities that we're used to doing in other kinds of categories and bring them to healthcare is really exciting to me. What I look to do is make sure that everything that we do is fully accessible, no matter how you choose to engage, no matter what language you speak, no matter where you like to shop. I want to make sure that everybody is really, really supported. One of the things that we found is that because other players in this space that did not build the financial technology rails that we did, which is really the special sauce that we brought, have a tendency to have people end up at the front of the cash register, at the front of the line, trying to swipe a card, and it doesn't work because products aren't covered or there's something that's gone wrong with it. And that's a horribly, embarrassing, mortifying moment because a lot of people we serve you have to then put things back. They may not have another card in their wallet that they can use. So we really aim to make sure that anybody who has one of our cards understands exactly what it is that they can buy with it. We've got an app with an item scanner so they can scan things in store to understand if it's going to be covered. We speak to them, in IVR. We've got a call center. We've got emails. We've got SMS. We've got app. We've got a digital experience that helps them understand what they can buy, how much money they have, when it will reload, where they can shop, and any of the other intricacies around, this kind of program. We want to make it easy, clear, and really, delightful, which is what anybody deserves. So it's really about sort of bringing dignity back to the experience.
There's also an opportunity for both retailers and brands to help with that story of ease of use and help folks know what's available and eligible for their spend. And so we work closely with our retail partners, whether it's in-store signage, right, or different parts throughout the store that are merchandised specific for this use case, which we're seeing more and more retailers invest in, is another way when you can hit them with a shelf blade in store. And then, of course, the brands, what they're interested in when Julie mentioned direct mail is how do you show up at those key intent to buy windows when a benefit's about to expire and allow people to know that they have products they can spend on that we know that they're interested in based on the user research we've done.
That's fantastic. Just as we're like close to closing our conversation, Jared and Julie, I would love to hear just what are 3 big takeaways that you'd like to leave with our audience about the importance of this space?
For me, it's really simple. We have a known addressable audience. They have money on cards that needs to be spent or it's going to disappear, and we can provide complete closed loop reporting on how people are spending it. So we are the best opportunity for brands to reach this 65 plus consumer with the kinds of things that they want to make sure that they're getting more than their fair share of available dollars spent on.
Awesome. There's a massive opportunity for brands, it sounds like.
Massive opportunity. Jared, how about you?
Yeah, I mean, that was really well said. I think we pride ourselves on being very collaborative. And I just got off the phone with a brand earlier today, and they had a ton of great ideas that we hadn't thought of. And we're a nimble team that can react to those things. Our tech enables us to really play in the sandbox with brands and figure out how we show up in ways that matter for the folks that we serve. So would love for any brands interested in this space or this demo know that we are here to test and learn together and figure out how we win for everybody.
I think we're sold, Rachel.
Yeah, definitely. Definitely. It's really cool. Yeah, we've had a couple of conversations with you in the past and really fascinated by your business. So really glad you came on the podcast, and it's been a great conversation. Thank you so much.
Thank you, guys.
Thank you.
Thanks so much
Really
for the
appreciate
opportunity. Appreciate it.
All right, Barry. Well, great conversation with Jared and Julie. Here for the audience is our top 5 takeaways. Number 1, The name SODA, as part of SODA Health, stands for Social Determinants of Health, reflecting the company's focus on addressing factors outside traditional healthcare that affect well-being. It provides a fintech solution that powers debit cards loaded by health plans for preventative benefits. Medicare, number 2, Medicare Advantage market opportunity is pretty massive. There's approximately 35 million Medicare Advantage members using prepaid cards with an average benefit value of $1,500, creating a $30 billion addressable market for brands to target with OTC food and other preventative health products. It's basically money that's just kind of there that brands can tap into. It's definitely not a lot of awareness out there about that. And number 3, there's a lot of benefits for stakeholders. The platform benefits consumers by extending their effective purchasing power. It helps brands efficiently reach health-conscious consumers, perhaps looking for the brands that they offer, and it supports retailers through increased store traffic and sales.
Number 4, they're also tapping into consumer engagement and personalization. So, yes, they can help drive transactions. That's kind of first and foremost, but they're also providing like these personal communications to the users that remind them of flu shots and just different ways to integrate into the retail pharmacy. So that's like another major benefit. And then I especially like point 5. Like, this isn't necessarily a theory. Theories are great, but this is actually like reality. So the brand partnerships are driving success metrics. So they do have these early partners, Haleon, Voltaren, as a brand, Abbott Labs. They have, created, with Soda Health, these targeted programs, high value coupons, Medicare Advantage catalogs. And 2 key metrics that are working, which I think most brands kind of like, is 1, new to brand, customer acquisition. Like, that's check the box. This can help with that metric, pretty important. And then secondly, I love how they look at share of the available dollars, through this government program. So you can track your share and see how, that's working for you. So really something worth partnering on, especially if you're in this sort of modern health space.
Well, fantastic. Barry, that brings us to the end of this episode. Thank you so much to Jarden and Julie for joining our discussion. We hope you enjoyed our show. And as always, thanks for listening to the Kantar Retail Soundbites podcast.
And a special thank you to Victoria, or Tori as we call her, for producing and marketing the podcast, who was just married and everything went fantastic. And we're just so proud of her. And with that, we will see everyone in 2 weeks. Thank you.